Hi everyone, it's Dr. David, the paediatric ENT doctor. I have had a special request on a topic which I'm very happy to oblige with. This has come from one of the nurses that I know quite well, who is aware of the work that I do and the chats that we have in the operating theatre. And she's aware of there being obviously sort of Facebook groups, that sort of thing, some questions that come up, particularly in the context of children with autism or on the spectrum for autism. And being a paediatric ENT doctor, I see lots of such children. I mean, I see lots of children, so by default, I see lots of such children too. And they come in with things that I can help explain to parents and so forth in terms of things that they've been struggling with and wondering, is it the autism or is it something else going on? So I just want to share some insights into that. So the first thing I want to say is that there's absolutely no reason that somebody with autism can't have other ear, nose and throat problems going on. The challenge can be with children with autism, because of that neurobiodiversity that they have, is that it can impact on how they explain things or experience things. So, for example, it's not unusual that they'll have a very high pain threshold. So it's not unusual that they will have quite rampant, awful ear infections going on and not have any pain that they're complaining about. Sometimes the first thing they notice is because the eardrums rupture and burst that there was a problem in the first place. So that's not unusual in that scenario. But my main thing that I want to sort of explain is how problems with the breathing and the sleep can also have impact on other things, in particular something called a sensory processing disorder. So let me explain a few things. Basic principles: kids are not supposed to snore. They're not supposed to mouth breathe. They're not supposed to stop breathing at night. They're all bad things, and suggesting that there's an airway obstruction problem. And it doesn't matter what the context of the child is, that needs to be addressed. When it comes to children with the autism, it's not unusual that they will have sleep problems. But the other thing to be aware of is that if they have any type of breathing problem, the impact that has on their brain function can actually be magnified substantially compared to other children who are not within the spectrum. And getting those kids, sorted across the board makes a huge difference. And with the autism, we may still have other issues going on that are autism related, but even if there's a marginal improvement in terms of their daytime function and so forth, that is just an absolute wonderful outcome in terms of improving their quality of life and obviously affecting those that are around looking after them too. The other thing is this thing called a sensory processing disorder. And this often comes up in terms of their oral side of things, where they don't like things inside their mouth. One thing I want to highlight that I think every parent should know, regardless again of the scenario, is when a child has a breathing problem, particularly if it's related to trouble breathing through the nose and they have to mouth breathe. As a result of that, they will have a tendency towards survival mode. And what I mean by that is when it comes to eating or drinking, if they have to mouth breathe to survive, that wins over eating or drinking. So when it comes particularly to eating, what they will tend to do is avoid foods that are hard to chew on. Anything that it takes a bit of effort and chewing and swallowing and so forth, they will tend to avoid. And people will put that down in the autism group as a sensory processing thing, as they don't like solids. That could be true, but it's probably more true that they just don't like not being able to breathe properly. So as a consequence, they're not dumb, the brain is very smart, they get into survival mode. And as part of survival mode, they will then avoid those hard, solid, textured foods. So you can make a misstep in terms of observation and conclusion. And then the other thing that ties in with this then too is that it also can know the fact if, for example, they've got big tonsils and it's hard to swallow past those tonsils, because again, they tend to be very sort of introspective and sensory. That difficulty is perceived as a challenge, which is a challenge that they avoid, by, again, avoiding hard foods. So I just want to highlight some ear, nose and throat things that creep into children in general, but are magnified in terms of how they can present in kids with autism spectrum disorder. I see lots of children with this, and sort of have skills and strategies to get around. The scenario, the parents will say, oh, they don't like people looking in their ears, or they're terrible, when someone looks inside their throat. And then, we build some rapport, and we seem to do okay most of the time. Not all the time, but, most of the time we do okay. So I just want to, again, highlight this issue and this topic. And I want to highlight how the ear, nose and throat contributions to symptoms can be overlooked. And it's really important to get a pediatric ear, nose and throat doctor involved, one that's good with kids, understands how these things interrelate, has got a lot of years of experience. I've been doing this thing now for over 20 years, so I'm always still learning, but I'd like to think that what I've learned over those 20 years is worthwhile with regards to dealing with these scenarios and understanding them. So again, just want to share that with you, and we'll see you at the next video. Bye.